Thanks, everybody. So we're just moving on to the next segment. We have a very special panel now coming right up. I'm going to introduce Dr. Emily Hennessy, and then Dr. Hennessy is going to introduce our panelists for the next segment. I had the great pleasure of I've known Emily for many years, and she eventually approached me with the prospect of coming to work at the Recovery Research Institute, which I was absolutely thrilled about. And we were able to get Emily to come, persuade her to come, and she's just been a powerhouse since she's arrived here at the Recovery Research Institute and the National Center, where she is the Associate Director. Emily has a long track record in the field. She's someone who's very dedicated, very passionate, particularly on youth prevention, treatment, and recovery. And that's where she has focused her work, particularly on recovery capital and understanding youth-specific recovery capital and all the elements. And she's been a pioneer there. When nobody else was focusing on that, Emily really stepped up to the plate and made that her mantle, and has done fantastic work. She's also done a ton of work in systematic reviews right across the field, and that's been a very important, it's a very important piece of science, is really aggregation of what we know and be able to do that properly, correctly, with the right degree of rigor so we can learn from the current research. And Emily's been a champion. So Emily, I'll pass it over to you. Thank you for coming.
Great. Thank you. Thank you, John, for such a warm introduction. I am really excited about this session. I'm really delighted to welcome you all to it. We will be talking with two parents today about their experience in this session, the heart of the matter, families navigating the substance use epidemic. Today we will be talking with Stephen D'Antonio and Deb Schmill. Stephen D'Antonio is an advisor to researchers, entrepreneurs, addiction providers, and a parent-peer advocate with various positions. He was a 2018 Advanced Leadership Fellow from Harvard University with a focus on addiction. He earned an MBA from Harvard and a BA in economics from Dartmouth College. He spent 4 years as the executive vice president of Shatterproof, a national addiction nonprofit, developing educational materials and tools for families. And if you're interested in finding out more about those organizations, you can scan the QR code. He's also the creator of the website Love the Kid, Hate the Disease, Lessons Learned from a Father Dealing with His Son's Addiction. He's a co-creator and participant in the podcast series, My Child and Addiction. He is a volunteer, parent peer addiction coach with Northwell Health, and is also an advisory board member for Care and Treatment Centers and for the National Center on Youth Prevention, Treatment, and Recovery. So welcome, Stephen, to our panel. Deb Schmill is the founder and president of the Becca Schmill Foundation, a not-for-profit foundation started after the loss of her 18-year-old daughter to fentanyl-laced drugs. The foundation funds research, sponsors community education programs, and advocates for policies to protect youth from the harms Becca experienced. Before starting the foundation, Deb earned a BA in accounting from the University of Massachusetts Amherst and has worked as an accountant and computer programmer. She also spent 2 decades advocating for climate policy. Early in her advocacy work, she founded the Needham Community Farm, a not-for-profit providing food for needy families and gardening education for youth. We are so fortunate today that they are willing to share their experience as families and parents. So we're going to start with Stephen. Can you share a bit about your family's journey with substance use disorder? What were some of the most challenging moments, and what helped you navigate them?
Here we go. Life never goes exactly as planned. I'm going to begin by taking you to a moment in my life that I could never have predicted. On Saturday, March 15th, 2014, my wife and I were at home watching Saturday Night Live and waiting for the youngest of our 5 children to come home from a night out. We heard a loud ruckus at the side door as our son stumbled into the house. He was crying hysterically, trying to tell us something really important. But he was blithering and nearly incoherent. Panicked, we kept saying to him, "Stevie, what happened? Tell us, what happened?" Slowly, the details emerged. He told us that he had just lain down on the local railroad track, ready to take his own life. At the last moment, he listened to a friend begging him to save himself. As the train was entering the station, his friend pulled him up onto the platform, and he survived. Thank God. He was 16 at the time. Our lives would never be the same. The next 2 years were a living hell. Every day, I walked on eggshells in my own home. Nothing was easy. We almost lost Stevie 4 times by the time he was 17. I have never experienced anything so complicated and scary as having this very sick kid certain that his survival depended on the very thing that was threatening to kill him: alcohol. I had very little hope that my son could ever become healthy and live any kind of normal life. I was wrong. In my journey as a caregiver for my addicted adolescent son, there were 2 powerful difference makers. First, getting professional addiction counseling for Stevie. I cannot say enough positive about the amazing counselors and therapists that helped me and Stevie and my family in this incredibly dark time. As many of you know, the recovery roadmap is fraught with twists and turns, difficult messages to deliver, and complicated situations. Our professional team was able to deliver much-needed wisdom, judgment, information, skills, tactics, and therapy to help us change the game. In my view, addiction professionals saved my son's life, and I will be forever grateful. The second powerful difference maker was my wife and I participating in our son's recovery process. We were required by the treatment team to attend weekly multifamily and parent support group meetings, all run by the counselors. At first, I was deeply skeptical of these meetings. Again, I was totally wrong. These meetings were truly life-changing for learning critical things about the disease and what my role as a caregiver needed to be to help support my son's recovery. And the magic of these meetings is that we learn from both the professionals and the experienced parents. The experienced parents had a particularly powerful effect on my wife and me. The first thing that I needed to learn, and many families need to learn, was that my son and his behaviors were dominating me and my family. He was only 16 years old, but the sickest person in the family was running the family. Stevie wanted what he wanted, alcohol, and he had no rules to get it. This disease plays hardball. He exploited my fear and guilt. He would say to me, "You are the cause of my depression. You are ruining my life. If it wasn't for you, I would be fine. You are the worst parent in the world." He divided my wife and me. While we were busy arguing and fighting about what to do, he was doing whatever the heck he wanted. And he expertly used dishonesty. Like many with active substance use disorder, he was an unusually effective liar and manipulator. Hard and painful lessons came with every one of those experiences with my son. It was chaos, and I had no idea what to do. The toughest lesson for me was the slow and humbling realization that it wasn't just my son who had to change. I had to change. I tried to manage and fix everything. I tried to keep the peace. I thought I was helping my son. I even thought I was saving my son. But the counselors and experienced parents, in a very supportive and empathetic way, just kept asking me, why would he change if you keep fixing his problems and making life easy for him? I finally realized that I was protecting the disease and not him. 6 months into the treatment process, I took a leap of faith and threw down the gauntlet. I told Stevie in early September of his senior year of high school that if he drank again, that we would likely send him away to residential treatment. This was tough stuff. He was an AP honor student, captain of the high school soccer team, and he had lots of friends. Sending him away would likely mean that he would miss much of his senior year, not apply to college, and not graduate high school on time. He didn't believe me. And why should he? My track record was bad. 2 weeks later, on a Saturday night, he got blackout drunk. I tracked him down at a party and brought him home. He was loud. He was belligerent. It was bedlam in the house. My wife and daughter were hysterical, alternating between crying and yelling at me, "Do something, do something." He taunted me. "Come on, hit me. Hit me." I have never been so defeated, so helpless in all my life. All I could do was say to my wife, "Call 911." The police arrived and calmed the situation. 2 nights later was put up or shut up time for me. I told him that if the counselors recommended residential treatment, then he was going. He looked at me with a piercing stare and said, "If you do that, you will no longer be my father. You will have 4 children and not 5. An amazing calm suddenly came over me. This calm absolutely came from my work in the parent support group meetings. I looked at him and said, "I have never been more of a parent than I am being at this exact moment. If the recommendation is residential treatment, then you are going." Then my wife and I left for our Monday night parent support group meeting. That confrontation was the single hardest thing I have ever done in my life. I was scared out of my mind. Would he get drunk? Would he run away? Would he hurt himself? We were gone for 2 long hours. When we returned, there was a note on the side door. I said to my wife, "Damn, he ran away." Slowly, we walked up to the note. It read, "Dear Mom and Dad, you are right. I have a problem. Please don't send me away. I will go to counseling. I will read the big book. I will go to AA and get a sponsor. And if I have one more drink, I will voluntarily go away for help. Love, Stevie." Huge breakthrough. My wife and I and the counselors, after days of deliberation, decided to accept his proposal. 5 months later, he relapsed. He was on an overnight class trip and drank a 5th of Jack Daniels. We got a call that he was unconscious and taken away on a gurney to the local ER. We heard nothing for 7 excruciating hours. The next morning he called and he said the most beautiful words that I've ever heard in my life. Barely audible, he said, "Dad, I am powerless over alcohol. Please get me a bed at Karen Treatment Center." No 17-year-old uses the word powerless, and no 17-year-old asks for a treatment bed without going through a massive transformation. He had done a lot of amazing work. And no parents are ready to effectively handle these intense and emotional altercations without also doing great work. My wife and I did all the things that we learned from the counselors and experienced parents. We got on the same page for parenting decisions. We set boundaries and consequences and applied leverage to create change. We let natural consequences happen. And we constantly used positive reinforcement and encouragement for any healthy behaviors and for any new sober activities to help him rebuild his life. We all know that it doesn't always work like this. There is significant risk when kids are addicted. We did what we were counseled to do, and we were blessed. Finally, if you're wondering about Stevie, today he's 27 years old and 9 years in recovery. Thank you. He is happy. He is healthy. He is hilarious. He has a ton of friends, and he's a loving uncle, brother, and son. He's engaged to be married to a great girl in June. I am beyond blessed that Stevie and I now have a very healthy and loving relationship. He's now living a life of purpose in New York City, working with young men and women to find long-term recovery. I could not be more proud of Stevie.
Stephen, thank you so much for being willing to open up and share your story with the group, because we know that that is what can help other families experiencing something similar really connect and reach out and talk to other folks and reduce the stigma for families. Knowing what you know now, what advice do you have for others who may be on a similar journey?
My advice is do not go through this alone. It is really hard. But the 4 things that I tell people are probably the 4 things that every clinician in this room would tell people. And that is, first, get addiction professionals involved early. Almost no one is prepared to deal with this problem on their own. The second thing is to get as educated as possible about the disease. Addiction is complicated and I think often counterintuitive. My best ideas were often dead wrong. Third, find support from experienced and educated people. Learning from experienced others is super powerful. And the last one, I did not take this advice. Take care of yourself. I didn't do it. It was a mistake. Recovery is a marathon and not a sprint. And to be helpful, we have to stay resilient.
Thank you for sharing those key tips. So we're going to move on to Deb. Deb, can you share a bit about your family's journey with substance use disorder? What were some of the most challenging moments and what helped you navigate them?
Thank you. Is this on? No. Sorry.
Try it again. Here we go.
Thank you, Emily and John, for inviting me to be here today. It's an honor to be here. I appreciate the opportunity to share my family's story with everyone, and I hope our experience provides helpful insight for all the great work that everyone here does. My daughter, Becca, would have turned 24 this October. She was beautiful, a beautiful, caring person with a smile that melted my heart. She loved summer camp, gymnastics, guitar, and being around friends and family. She had hopes and dreams. She was looking forward to going to college, and she never got a chance to do that. Before starting her first year at the University of Richmond, Becca and a friend decided to go online and get some cocaine, and what they purchased was laced with fentanyl. So at 18, all of her dreams and all of our dreams for her vanished. Fentanyl may have been the official cause of death for Becca, but the path that led to that terrible day in 2020 was really paved with trauma. When Becca was 15, three years prior, she and some friends met some older boys online and got together with them, and my daughter was drugged and raped. After that, she was cyberbullied in a related incident in a devastating way by her peers. Afterwards, Becca would say that she had this emptiness inside her that she couldn't figure out how to fill. And her parent and me and my husband, we didn't know how to help her. We got her therapy, and she refused to talk. You know, I later learned the last thing you want to do after trauma is talk about what you've been through, but I didn't understand that at the time. And we didn't know what to do. She was in a downward spiral, and one of the worst parts about the downward spiral was the rejection from her peers. I think out of everything, that was a lesson we learned. I mean, to be so shut out from her community of peers was just devastating for her. So she soon started drinking. and she got into riskier and riskier behavior. By the time she was 17, she was using pills every once in a while. I don't think all the time, but weekends and things. At this point, she was in therapy. We were doing family therapy. She had participated in a program at a hospital, very well-known hospital, for youth with substance use issues. She wasn't considered addicted per se, but she was struggling. She was struggling mentally and was searching for a way to feel better. So she was doing that. She spent 2 sessions at McLean Hospital in residential treatment. And in all that time, not one person told us about fentanyl, and not one program sent her home with Narcan. So Becca came home, she continued struggling, but at the same time, she was going to school, she was getting good grades, she was working, she was living her life. And then she was found using coke in the bathroom at school. At this point, she was 18 years old, and everything really changed. She then was in the adult system, and Becca, as an 18-year-old girl who had been sexually assaulted, was not prepared for the adult system. So she had her first experience going to adult residential treatment just as COVID was starting. And many programs were shut down temporarily. It was hard to find a bed. We finally did find a bed in some place nearby. It was our first time doing this. We didn't really know what we were doing, what we should be looking for, but yeah, she went to her first, she had her first experience, and it was co-ed, and she came back more jaded than when she went in. In the 3 times that Becca went to residential treatment, each time she was with people who had been in recovery in this cycle for decades. And all that did was tell her that there was no hope for her. And these people would tell her, you have to hit rock bottom before you can get better. And she took that to heart. So she did not see a future for her. The other thing that happened in one of these places she was at, she got into a physical relationship with a man. And in the last place she was at, there was a gentleman making her and a few other women, young women, feel very uncomfortable. And for some reason, the girls had their phones at this place. After detox, they gave them their phones. I don't know why. But everything, all these girls had been sexually assaulted. They were feeling uncomfortable. They weren't safe. My daughter also got terrible news on her phone. Someone who she had met in previous treatment had died. I mean, why she should have had access to that kind of information while she was in treatment, I don't know. So these girls, because they had their phone, they went online and they found someone to throw drugs over the fence. The girls got high and were caught, and they were given the choice, either go to detox or leave, and they chose to leave. So we went to New Hampshire, picked up Becca, and she tried to take off with another girl to go live in the streets. This was one of the scariest moments of my life. My husband was chasing her. He grabbed her, put her in the car. People witnessed this. They didn't know if he was kidnapping her. We got chased down the highway. We were frantically calling the police to let them know that we weren't kidnapping our child and we were being chased by people who were trying to do the right thing. It was terrifying. We ended up convincing her to stay with us. We moved into a friend's place that was empty in Maine, and we invited her friend who she was going to meet up with to come live with us because we were afraid she was going to take off otherwise. And this girl, her parents wouldn't let her back home. So for about a month, we lived like that. It was extremely stressful, but the girls got jobs. They did, it was COVID, so there wasn't in-person sessions, but they went online to do support groups. And we did this for about a month. And then the girls decided to go online and find cocaine. And even though we were in a different state, you know, they didn't have connections with drug dealers there, but social media made getting drugs frictionless whenever they wanted. So, the girls picked up cocaine, and that night we learned the cocaine was tainted. It had been laced with cocaine. Had been laced with fentanyl. And I found my daughter's lifeless body. And her friend just barely survived, but fortunately the ambulances came and she did survive. So this is our story. I mean, my daughter, who was a loving, wonderful person who I adored, was gone. And I realized, thinking back at everything we had been through, you know, there were plenty of mistakes that we made as parents through this process. We did not join support groups. We didn't feel like we needed it, and had heard a lot about support groups telling kids, similar to some of what you said. I had real concerns about support groups telling me not to enable my daughter and not to let her back in the house. So I had an attitude about it and thought we could do better. And so we didn't do that. And I also think throughout the process, I was in denial. A part of me kept thinking, she's going to be okay. You know, she's not going to go to college. That she deferred, and she's going to take the year, and she's going to get better. We're going to work with her, and she's going to get better. And she's going to then start a new life in college the next year. And I convinced myself of this. But what I didn't know was fentanyl, was that there was that added risk, that at any moment, whether it was a pill or cocaine or whether she tried something else, that it could be immediately deadly. And to me, that made a big difference, I think, in just feeling like I knew it was urgent, but I didn't know how urgent. So, and so for 3 long years, we suffered through this. We tried to balance between being supportive, trying to put boundaries, but not wanting to push her away. And it is a really hard balancing act that you're experiencing. And I don't know if we were doing it right, really, or not. We never got a chance to find out.
I'm so sorry, Deb. And also, thank you for being willing to share your story with everyone and really honor Becca's memory in this way. So thank you. And so knowing what you know now, what advice might you have for others who are on a similar journey?
First thing, as you may have noticed, I am a big proponent of letting everybody know about fentanyl and of harm reduction. If I knew, I would have been having long talks with my daughter about if you're going to use, because I understood that was the reality. She was going to use. I couldn't just tell her, don't do it. She was going to do it. But if you're going to do that, never do it alone. Always have Narcan with you, and only do a little bit. And, all the harm reduction related things that you all know. That would have been number one. Number two, I would have joined support groups. I think that would have been really, really helpful to learn from the experiences of others around us. And also, I did try to find age-appropriate programs for her. And particularly once COVID hit, we couldn't find a bed anywhere. But I think maybe I would not have sent her to adult. After that first experience, I would have kept her home before sending her anywhere. So, yeah, those are some of the things I think I would do.
Thank you again for your advice there. We're going to ask a few questions now, really kind of scoping out a little bit about the gaps in the system, really to get your experience as parents. And also, I think, there's a lot of researchers here and funders, maybe policymakers, that can really begin to think about how to tackle these gaps. So, Stephen, from your perspective as a parent, what gaps did you encounter in the prevention, treatment, or recovery process?
So in my view, prevention is our most cost-effective way to significantly change addiction in this country. But I think the headwinds are really, really tough. First of all, we've legalized and normalized cannabis use, while the potency has increased to what I think are obscene levels. We have massive corporate alcohol advertising budgets. Common culture glorifies alcohol and drug use, and use by teens is viewed as a rite of passage. And this is a big one, a lack of long-term investment focus by our leaders in virtually every endeavor weighs heavily against prevention spending. PowerPoint presentations to middle school kids on addiction prevention in health class is not going to prevent a 12-year-old from vaping. It's just not. Personally, I need to learn much more about prevention to be part of the solution, and I'm thrilled that at this conference, there's a bunch of presentations that talk about the role of parents, families, culture, policy, and I'm going to be attending many of those. In terms of treatment gaps, to be honest, I don't think that my family's experience with addiction treatment is a common experience, and that's a shame. We had incredible access to experts and proven resources and way better information than most families. Most families are completely lost on where to even begin. Recovery gaps. I think this is a huge one. 28 days, I'm preaching to the choir, I know. It is just not enough. It's not even close. We stabilize people, and then after 28 days, we expect them to go on to live their lives and stay in recovery. It's insane. An important secret for the high-quality residential providers is that they insist on robust aftercare. After 28 days of care, Stevie spent 3 months at a very structured sober living home. He went to school, and he also attended IOP and daily AA meetings to begin to rebuild his life, to learn how to live in recovery. If we don't fix the aftercare gap, our outcomes will never be what they should be.
Thank you. Yeah. So it sounds like you had a really positive experience with the system overall, but are there any changes that would have made the biggest difference for your child and your family?
So in terms of the changes, I think that I'm telling you, we were really fortunate. Right? I had incredible access, which is not really the experience for most. The most unacceptable problem today is that the treatment system is nearly impossible to navigate. The general public needs hand-holding just to answer two basic questions that get answered quickly and naturally for other major healthcare issues. The first basic question is there a problem? For health issues, you go to a primary care doctor, and the doctor does diagnostics and makes an educated referral. With addiction, who do you ask? The internet? The second basic question, once you suspect the problem, is where do you go for help? With healthcare issues, the system's right in front of us. Primary care doctor, specialists, hospital system. With addiction, what's the right level of care? Who are the proven providers? How do we find them? Unfortunately, the internet drives everyone to residential treatment, even though outpatient care could be the best first stop for many, including my son. Why? Because only residential providers have the money to advertise, especially given the payoff for filling a bed. We have to do way better answering these two basic questions for everyone.
Yeah, we certainly do, yeah. Deb, from your perspective as a parent, what gaps did you encounter in the prevention, treatment, or recovery process?
Sure. So in prevention, I think really the lack of trauma-informed support for my daughter after she was sexually assaulted was really the big start. I've read statistics on how many of the women in substance use treatment have been sexually assaulted, and the numbers are just horrendous. So for me, prevention starts with preventing trauma and supporting people who have experienced trauma. After Becca was sexually assaulted, she went to the doctor. They did some, the standard tests, and that was it. That was it. We had no place to go, didn't know what to do, no support. I think Becca really could have used a peer support system, a place where she could just be, and actually Dr. Kelly mentioned this before, I 100% agree in getting peers together who have experienced, but doing activities that they enjoy. I think that would have been amazing for her. I also think that we need better education in the schools, and of course, our kids starting in middle school on, they should, at least middle school on, they need to be learning about fentanyl, and they should be learning how to administer Narcan. I think that's a big gap in overdose prevention, obviously. Yeah, and I'm on the wrong page.
It happens.
Yeah, that's why I couldn't find what other things. But, so, anyway, we'll go on to the next question.
Well, the next question is related. So what changes would have made the biggest difference for Becca and for your family?
So, changes, I think, without a doubt, aside from what I said before, in terms of better help for trauma, better supports for trauma, without a doubt, age-appropriate trauma-informed treatment. Yeah. It is, to me, it blows my mind that girls who have been sexually assaulted once they are adults, are in treatment, and there's such a limited number of places. There are some, but to get a bed there, that girls could be expected to get better in treatment with, in a place that does not feel safe to them. Right. No offense to the men here, but for her, and for many girls who've been sexually assaulted, that just isn't going to work. Add that to what Steve was saying about, 28 days. Mm-hmm. I mean, I've read that it takes about a year for a young child, for their brain to heal. How can you expect these children to heal that quickly? So we need parity. We need kids who have addiction, adults who are suffering with addiction, need to be treated like they have any other disease, and you all know that, and that is obviously a big gap.
Yeah, thank you. So both of your answers and stories have really touched on a strong need for a really robust continuum of care. So Stephen, how did your experience shape your understanding of addiction and recovery? And what do you wish more people, especially professionals and policymakers, understood about supporting families?
Yeah, so mostly I'll talk about what I would like the professionals to know. Dr. Tom McClellan, Lifetime Achievement Award winner from both the American and British Societies of Addiction Medicine, a legend in the field, once told me that when his 2 sons became addicted, he had no idea what to do. Mm-hmm. If Tom McClellan had no idea, who does? The answer is nobody. Caregivers need help desperately, and I cannot say this strongly enough. Caregivers are essential to any effort to help our youth with prevention, treatment, and recovery. We need to give them tools. When treating an adolescent, I think providers should require caregivers to participate in education, support, and skills training. It doesn't matter if the caregivers have been successful raising other children. They need help. My wife and I were very successful raising our 4 oldest kids. But because we couldn't agree on how to handle Stevie, we were literally on the verge of divorce, fighting all the time. And because we were not addiction educated and did not have the skills we needed, anger, frustration, and fear were introduced into almost every interaction with Stevie. The environment Stevie grew up in was very different from his siblings. My wife and I contributed to the chaos and dysfunction in the household. And our story is not unusual. Parents have no idea what to do and often, unwittingly, work at cross purposes with the recovery process. The second critical thing to know for professionals is that there is a window of opportunity for caregivers that diminishes with time. When a child is young, 12, 14, 16, the leverage and ability to influence the child is much greater than when they're young adults, 22, 24, 26 years old. We need to be super aggressive about getting tools to caregivers before they lose much of their leverage and influence. Once a child is off to college or has some financial independence, the ability to influence is much, much lower.
Thank you. Yeah, and you've been really active in your advocacy work around these ideas, so we'd love to hear more about your efforts to educate others.
Yeah, so after 30 years on Wall Street, I guess I'm atoning for my 30 years. and I am now on a mission to build really good tools for families. And there are 3 unique and free assets that I'd like to highlight today. The first you had mentioned before, which is the website, Love the Kid, Hate the Disease, lessons learned from a father dealing with his son's addiction. The URL is addictionlessons.com. Storytelling is incredibly powerful, and it's a powerful way to teach. And so what I've done on the site is to share very personal and gritty stories like the ones you've heard today, and through those stories teach other caregivers all the things that I wish that I knew about addiction, but I didn't when my journey began. I meet people where they are, hopeless, frustrated, exhausted, baffled, angry, and most of all, scared. There are 12 short stories. Each takes 2 to 4 minutes to read. The whole site takes 35 minutes to learn really critical stuff. First short story is called There's Great Hope. People need to know that there is hope. Treatment works. What you guys do is amazing. But story after story teaches critical things like the stages of change. Essential content for caregivers to understand the recovery process. I was blind. Most people are blind. We have no idea what's actually happening. Stages of change explain a lot. Well over 400 people have been on the site, And the average engaged user spends more than 8 minutes on the site versus less than 1 minute for an average website. John has endorsed it. Dr. Tom McClellan have endorsed the stories. I'm grateful for both of their endorsements. And we know education is a really important building block. But addiction-related skills can change lives when dealing with this disease. As most of you know, Dr. Bob Myers created an extremely powerful skills-based intervention for families called CRAFT. It works. There is a fantastic new web-based company called We the Village that has created a high-quality online craft product in partnership with Dr. Myers. Their NIH-funded clinical trials have yielded the same results as face-to-face craft. We the Village is presenting here on Thursday morning. I am such a believer in craft and the great work that We the Village has done that I recently completely redesigned my addictionlessons.com website to send as much of my traffic as possible to them. Second unique asset is a podcast series called My Child in Addiction. It was created in JV with Caron Treatment Centers. It features 8 experienced parents like me and a professional having very raw and open conversations about the issues affecting parents dealing with an addicted child. We've published 68 episodes to date. Vulnerable conversations around things like shame and blame, co-occurring disorders, the emotional roller coaster, impact on family. The sharing is powerful. With almost no advertising, we have around 275,000 subscribers and growing. And finally, I'd like to share a third unique asset. This one was scary for me. The June 11th, 2024 episode of the Zach Clark Show podcast. Zach is probably the #1 addiction influencer in the United States today with nearly 700,000 Instagram followers. On this podcast, Stevie and I are Zach's guests, and together we share openly about our individual journeys and our journey together, the good, the bad, and the very ugly. We lay it out there as raw as it can be. It's a rare opportunity for people to hear a parent and a child openly share about the child's addiction, the recovery journey, and about their relationship ups and downs. And that's the Zach Clark Show, June 11th, 2024.
That's great. Thank you, Stephen, for all that advocacy work and to share your story with families. Deb, how did your experience shape your understanding of addiction recovery, and what do you wish more people, especially professionals and policymakers, understood about supporting families?
So what I learned in my experience is that a lot of things. Is that we need a change. We need a big change in the way we treat folks who are dealing with addiction. From every step of the way, from education through to the continuum of care when they go into treatment. One thing that I want to bring up related to this is, I got a first-hand look at stigma and how that impacted my daughter, and I saw it in the emergency room. I saw it, in the people around her, in treatment and everything, but particularly in the emergency room, and that was a shocking thing to learn. That often there is a disrespect, there's kind of like you're wasting our time kind of attitude. You can control this, why you here doing this? So that is something I've learned and would love to see change. The other thing, as I've mentioned before, that I think is just so important is that we start really thinking about gender-based treatment and trauma-informed, and age, and age. My daughter at 18 did not belong in an adult facility. So. So yeah, I mean, And so some of these things are the things that I'm working on with my foundation. So we fund research. That's one of the things we do. And we're funding a high school recovery research. High school recovery high school research, where we're trying to find ways to help kids in high school feel connected and to support their journey while they're in high school. We just did a study that will be coming out soon that looked at, it was a scoping study looking at the information out there about gender-based treatment and trying to determine the efficacy of splitting, which it's, as I said, will be coming out soon. But that's a particular passion of mine, as you may be able to tell. The other thing we do is we do advocacy, trying to get better policy out there at the federal and state level, pushing for better education in the schools that gets regularly updated based on what's going on in the supply, the drug supply. We are always looking to get Narcan into schools and get kids trained. Recovery housing in colleges is something that we have worked on in Massachusetts. On a national level, federal level, we have been doing a lot on social media and trying to get social media companies or platforms accountable for the drugs sales that are happening on their platforms, as well as many other harms that are occurring. So we were very active in pushing for the Kids Online Safety Act the last 3 years. And now we are pushing, unfortunately that didn't go through because of politics, but we are trying to work on the state level more because we think we could succeed more on the state level with online harms and fentanyl education. So some of the stuff we do.
Yeah, that's incredible. I just want a round of applause for, Thank you. Thank you both for your advocacy work in this space. So we do have about 5 minutes for questions from the audience. We can take maybe one or two, and then we'll wrap up the session. And there are microphones. There's one there, and there is one there as well. So, Mike.
Is there any good, given that you're advocating fentanyl education, is there any good site or program that you think you would recommend to people?
There is a program out of Stanford University. Can't remember the name. I will have to get that to you. But they do have, there is a program for high school students. I believe maybe they have expanded to middle school students. And as I am up here, not much of a public speaker and nervous.
Yeah, no, we can definitely get it.
My brain is not working. There's also a great program out of Canada that I will share, and maybe that can get out to folks.
Yeah, and there is actually a poster later today, Pill Patrol. Someone developed an app so folks can start to report where there's contaminated supply. So that'll be during the poster session later today.
I have one other to add on fentanyl. When I was at Shatterproof, we were obviously very concerned about fentanyl. We created a short video, education video. It's on YouTube. It's about 1 minute and 30 seconds explaining, how one pill can kill and all of these things. And what's interesting about that video, on YouTube, typically it's like the average person spends 5 seconds. It was 1 minute and 30. The average person spent 1 minute and 20 seconds out of 1 minute and 30. We had a huge amount of people looking at it. So you can look it up on YouTube, Shatterproof, Fentanyl. There's 2 or 3 different short videos that are really helpful, and you can give them to kids, you can give them to parents, should be helpful also.
Yeah, thank you. I think we have one.
This one's for Deb. What happened to your daughter's friend? Do you know that?
She spent a good year recovering from this because she was, so physically, her comprehension, her brain was just massively harmed. And she spent a year recovering from that. And as of the last time I spoke to the family, she was drinking again. And that was her thing. She was really more of a drinker. Yeah.
So, Stephen, I had a question about what did the weekly multifamily meetings look like? Were they, how many families were involved? What did they look like?
So, yeah, the question was the weekly multifamily meetings. So basically, it was the kids, the teenagers, and the parents. And in those meetings, we would have anywhere, and the counselors. There were probably 2 counselors in each meeting. And in those meetings, probably anywhere between 20 to 30 total people. And it was an hour-and-a-half discussion. And a lot of stuff came up. Generally speaking, the kids didn't want to participate as much as the parents. I think that's common. But it was a great way for parents to model to their kids that they were interested in learning and having conversations about difficult things. And it was really effective. The other meetings that we had to go to were just the parents and the counselors. And those were great because you could share strategies, you could share problems that you were dealing with. And so it was 2 different meetings. One was the multifamily and the other was just parent support group. Really helpful.
Follow up about confidentiality. Was there any concerns about confidentiality, HIPAA requirements?
Yeah. So they are very strict. It's Northwell Health, biggest healthcare provider in New York State. Extremely careful about all the HIPAA stuff. Nothing was allowed to leave the room. Now that they're doing stuff on Zoom, they don't let anyone go off camera. They don't let anyone else in the room. If somebody comes into the room, they shut them down. So they're really careful about HIPAA stuff. And they also had ground rules around, in the parent meeting, not sharing with your kids what was discussed about other kids or any of that stuff. So never really had any problems. I've been a volunteer there for 9 years, and so I'm sort of the experienced parent for those meetings for the last 9 years.
Thank you. And thank you both. It has been such an honor to have you share your stories with us and be so candid and just a true testament to you as parents. So
You did. It was awesome.